Want to know the secret to engaging with an influencer to increase awareness of a health challenge? Spoiler, it's not high end cameras, fancy studio setups, or even millions of views. What is the secret? Well, you're just going to have to watch this engaging interview with Brittney Strum. She's the marketing and business relations manager at Olmsted Medical Center in Rochester, Minnesota. She is one of the creative forces behind the Pelvis Party, an initiative to bring awareness to women's pelvic health. And she uses a local influencer to get that message out. We chat about what it's like to engage with an influencer, how she made the choice, and what it was that was the secret to their success. Let's get to it.
Sway Health.
Brittney, welcome to the program.
Thank you so much for having me, Colin. It's good to see you again.
It's good to see you too. I remember watching your amazing presentation at SHUSHMED a little bit ago, and now I'm glad that we were able to catch up here because I want to learn more about this amazing story and amazing work that you've done.
Thank you. I'm so glad that you attended that presentation. It was an awesome opportunity to share something unique that a health system's doing.
Yeah, and so before we dive into that, Brittany, if you could tell us a little bit about your role at Olmsted Medical Center and a little bit about the organization itself.
Sure. I am the marketing and business development manager. I've been with Olmsted Medical Center for almost 5 years, coming up in June. We are a health system in Southeast Minnesota with our largest base in Rochester. And then we have 23 locations across Southeast Minnesota. So that's our primary market. We have over 1,300 employees, over 200 clinicians, 35, more than 35 specialties. We continue to grow. We just opened a brand new primary care clinic and ambulatory surgery center in Owatonna. So really exciting things happening for us.
I don't say this often, but you are in a colder climate than I am, which is saying something because I'm pretty far north. So, yes. So hopefully you're staying warm, and
Trying to.
and
It's a little chilly today, but
well, hopefully this conversation will keep us both warm. So, as we mentioned, at SHUSHMED earlier this year, you were doing some amazing work on something called the Pelvis Party, like it was a podcast and a YouTube series. Can you tell us more about what that is?
yes, definitely. So the Pelvis Party started about 3 years ago. We're coming into our third season, and we could talk a little bit about that later. But when I came on as a new manager, I was evaluating all of the different marketing tactics we were doing. And at the time, we were still in the midst of COVID and trying to get information in a very busy and noisy market out about COVID vaccinations, pregnancy, impacts. And we had a relationship with a local online influencer, I would say, called Rochester Local, and we were doing a strictly a Zoom video series, kind of like what we're doing today. And we primarily had one expert that would come on and talk about the impacts of COVID. Um, the viewership was really low, and so the investment to me didn't make sense to continue in the way that we were moving with that video series. So the clinician that we had, her name is Dr. Melissa Richards. She's an OBGYN. Our partner, Becky Montpetit, with Rochester Local, and myself sat down at a coffee shop. It was very relaxed and evaluated, and then talked about what we wanted to see and what we thought women in the market would want to hear and what type of environment that could look like. And ultimately, we were laughing about our own personal healthcare experiences while we were evaluating this and thought that is what it should look like. It should be very comfortable. You should be comfortable having those conversations with your clinician, just like you have them with your friends. There are a lot of times I share a personal story with my friend, and while it might be funny or I might actually be seeking, like, have you had this experience? The difference is I don't have an actual expert with me, right? My friend is not an expert at anything that I'm talking about. So that's what we wanted to bring as a new program forward. And that's how Pelvis Party came to be.
So, well, I find that amazing. Like you're just at a coffee shop and then recognize that that's actually the kind of conversation you wanted to portray.
Yeah. And we realize, as a clinician, that is their job to be in a clinical space and sharing back and forth with patients. But how many times are patients not honest with what their actual symptoms are or what they're experiencing because they're not comfortable yet with that person, or maybe it's not the right fit, or the topic is embarrassing, awkward, and like we and women for so long, particularly, or anyone, have been shamed and made to keep our issues private. And we want women to know that no topic is off limits. That is what your clinician is there for. And you have to have a health system that's open to that. And that's their model and how they practice that patient comes first. And that's what we have. And it's really special.
That's really hard to do in any format, whether that's podcast, video, writing, of course, even in person. Like getting someone comfortable enough to share an intimate part of their story, whether that's a patient story, a disease story, any of those stories. So when you went into this, and as you were planning for this, how were you going to achieve that in your mind for this medium?
Sharing our own stories, which let me admit, like sharing my personal health care journeys. And same for Becky. She's our influencer because she's had so many interactions with our health system and she's a good brand partner. Um, but while it's very vulnerable, it's important because when people see other people sharing their experiences, they're more apt, and it might take time to share what they are having within their health or, whatever's going on in their lives. And I think it just takes a little bit of vulnerability and recurring messaging to reinforce that.
I love that. And when you mentioned on stage that you were sharing your own story and you even put your own video up there. I mean, I know how awkward it is to look at yourself on camera. So I can't imagine looking at yourself telling an awkward personal story as well. So kudos to you for being brave to put your story out there to encourage others to do the same.
Thanks. Yeah, that is hard. It was like, oh my gosh, that particular video I was sharing what I come my list that I come with to my healthcare provider every year during an annual. And I learned something in every episode too, that your provider actually has their own list that they need to get to. And I was kind of coming at it at the wrong angle. So it was helpful.
Now, you mentioned something that I was very fascinated about, and that was that you teamed with a local influencer to start Pelvis Party. Like you mentioned, her name was Becky. What made you decide to team with an influencer as opposed to like use your own staff, which like a lot of other organizations typically do?
I think it made it more relatable. And what's unique about Becky is she already has a platform that she's speaking from. So her business is called Rochester Local, and they bring a lot of resources and guides to the community, like the best camps for your kid for summer camps, where the top 10 places to sled, those kinds of things. So we were already advertising on the platform, and this just became so we had that trusted relationship too. So it became a natural extension of what we were doing. We just got a little bit more creative about what kind of story we wanted to tell moving forward. And because she's had so many interactions with the health system, we have story after story after story, and our even our new episodes coming out in 2026. You'll see just the different experiences that she's had, and she's willing to share them because she really wants women to feel empowered about their healthcare journey, just like I do and Dr. Richards.
So it sounds like Becky was very aligned in terms of the messaging that you wanted to send out into the community. I mean, yes, it's true. Most influencers have an audience that's built in, and it's nice to not have to start from scratch. But it's rare to have someone who's aligned with messaging beyond, I'll call it the collaboration, like beyond the paid collaboration or whatever kind of collaboration it is. So it sounds like you ended up with someone who really is just as passionate as you are about getting this message out there.
Yes, definitely. And when we think about what's changed with the podcast too, and I think what's very exciting is now we've established enough brand presence with Pelvis Party to expand beyond that. And we're talking about using other, what I coined in the presentation as patient influencers through a vetting process, making sure that they're, to your point, appropriate for your brand message. And candidly, not every patient is going to have a positive experience with a brand sometimes. And so that's something that we have to look at and be really careful about. And we select those people that we want to bring on the show.
How did you convince your internal teams to go with an influencer? Because I'm sure that wasn't easy. Because I think most people would start thinking about the risks involved with doing it this way and partnering with someone external to your organization. How did you convince them that this was going to work out?
I would say in the beginning, it was a pretty quiet initiative to see if it was going to work. But because we already had the trust with Becky and what we were doing with her with advertising, it was just an extension of our already existing advertising strategy. Um, and then with Dr. Richards, she has been a very strong advocate for doing things that are outside of the box type of marketing. And so with her advocating for the pelvis party, it made it fairly simple. But I did get questions along the way. I heard comments from leadership. Um, I don't think women my age are going to want to hear stuff like this. They want to be quiet about it. And we're finding that's actually not true. It's a little refreshing to see the age range of comments that we've gotten on our socials and what people are willing to share. And so we've used some of that content too for future episodes because we want to be responsive to our audience. But it's not always easy, and I still get comments from time to time. But I think leadership has been really excited about the response that we've seen. And on the other side of it, this could have been a total flop, and I'd be explaining, well, we're going to go with something different now. But I'm glad it wasn't.
I'm glad too, because it made for a great story. And
Yeah.
I want to pick up something that you said there as well. Like when you started this, it was sort of an experiment. It sounds like it was a little bit of an experiment to see if it was going to work. And I remember from your presentation, you made a comment that, on purpose, you started very small, very simple in order to keep costs very down. You didn't really invest a lot in a fancy studio with fancy lighting and multiple cameras and all. You started very, very simplistic, and then you evolved from there. Can you walk me through that?
Yeah, I think because we have a very small and nimble team, I knew right away I couldn't do this internally with my team. I do have a videographer, a graphic designer on staff, but we're already overextended with our other priorities for the system. So converting what dollars I was already spending with Rochester Local into this new concept was the only thing I had to go with. And we didn't put any money beyond the production, basically, into advertising the podcast or the video cast. And we also didn't have resources for them to be on their own platforms at the time. And that's something new that I've built into the plan now. I'm doing some contracting for social media for that to make it work. But we started out with a certain amount of episodes. That's all I could have put in the budget. And then from there, it just began to take off and we were getting the views. And now I've got the buy-in from leadership to continue moving forward with next phase.
And what were those expectations that you had going into it? Like what was success going to look like in those early stages for you?
Well, since I knew what was happening before, like a couple of the most of the videos that we were doing in the Zoom series before only had around 100, 120 views. And to me, that outcome is a little sad. And so anything over 5,000 views, I was going to be pretty ecstatic about. And then the engagements too, like seeing comments. And beyond that, I've heard anecdotal feedback from patients that have come into the clinic and shared with their clinician, I saw this episode on Pelvis Party and I want to talk about X, whatever that is, hysterectomies or UTIs. And so that is really powerful when you talk to leadership teams or you share the measurement and outcomes of what you're doing.
And if you can, share what are some of the numbers that you're seeing now that you've been on the air for a few years?
Now they it's a little challenging because we've since moved on to all of our platforms for Pelvis Party. So Pelvis Party can be found on podcast, which is brand new. We put all of our legacy episodes out from season 1, 2 out on podcast, and then YouTube and Instagram and TikTok. So we're kind of starting over with the views, but I've been really impressed with the views that we're seeing right off the bat on Instagram and TikTok because we've taken all of our video episodes and shortened them down to 30 to 90 second reels. and we're getting thousands of views just on those clips. And then the next phase, though, will be measuring the clip back to the podcast. So we want
Mm.
people to see the clip and then we want them to go listen to the full episode, right? So that's what I'm working on for 2026.
It's still thousands of views just on your on your reels is amazing for a health system. Like,
Yeah, and we've only been out a month on those platforms, so it's really exciting.
incredible, incredible. So what have you learned working on the Pelvis Party experience? Like, how, and what are you carrying from this experience forward to some of your other initiatives?
Yeah, that's a great question. The powerful medium of social media and what it still is in storytelling. I think as marketers, I know I feel overwhelmed at times at what can be done. And so you have to be just really intentional about where you're going to spend that time. So one of the things that I've learned is with the small clips, how can I now apply that and work with my communications manager on distributing some of our other videos because we do clinician profile videos. So how can we shorten those down into clips that are going to gain more viewership, get more people back to our channels, and ultimately to our website to view olmstedmedicalcenter.org and the provider profiles. So
Mm.
some of those kind of, and that's all scalable too. It takes resources, time to look and measure, and for me, sometimes I don't always know if I'm doing the right thing when it comes to social media or video. But when you start to see the results and you can adjust the strategy, so what we're doing with Pelvis Party is working, so let's apply it to our other initiatives.
I mean, that's great. I mean, it's great that you're applying some of those social tactics and the reels and things to your other videos, not just the ones that you're doing with your influencer, the clinical ones, the ones that are featuring and profiling your clinicians. That's pretty fun. I'm sure they're I'm sure they're kind of interested in becoming Instagram and TikTok famous.
Yeah. Well, now we have a line and a queue of specialists. So that would be another thing I learned in the beginning. It was really hard to sell something that didn't have momentum yet.
Right.
To get people, because being on video, as you know, can be hard. And like you said, you don't always like to watch yourself and you feel like you're going to fumble and mess up, say the wrong thing. So in the beginning, a lot of our episodes only feature Dr. Richards, and we have a ton of content with her as an OBGYN and a women's health expert that we can dive into. But I think keeping the same people doesn't always keep your audience's interest. So now that we've been doing this for a little bit longer and we've seen the results, Pelvis Party is the buzzword internally with leadership and with other specialists. And so I have a line of people who want to be on the show, which is amazing.
Success breeds success.
It does.
That's a great endorsement of what you've been doing when you have a lineup of people who want to be on the show.
Yeah, definitely.
So can you give us a preview of what the show is going to be like going forward? I heard a little bit that you said the 2026 season is coming soon. What have you got in store?
Yeah, so this last quarter, we've been filming new episodes, and we have a different pool of experts that are on the show that we're featuring, anywhere from our brand new urologist to dermatologist to lots of other specialties. And we're also branching out and bringing on new patients as well to share their experiences so we can really get into the storytelling aspect because I think it's powerful when someone can share. I was struggling. We have a patient that's coming on and talking about perimenopause and menopause. She started in her late 20s, and she talks about that journey and what it was like and how it impacted fertility. And then we bring on an expert to talk about why that was potentially and where she's at now in that health journey with menopause. Some of the other things, we're bringing on some listen only sessions, some audio only with some mini series, and that's
Mm,
the scalable piece. So I only have production numbers for 15 video episodes with our partner, but I want to be able to release more content in between that. So one way I can control that, which is relatively low impact to me and my team, would be to produce audio sessions. And so I can go out to clinicians where they are, meet them where they're at. So they're not traveling to us. We could do sessions like this and be able to produce more content and release that.
gotcha. Gotcha. And in terms of some of the production that you're doing, what have you learned in terms of keeping the cost down? And I guess what I'm asking is, what have you learned from understanding your audience of what they appreciate, what they don't appreciate, and where you're putting more resources as you move forward with these new seasons?
I think there's some intentionality that I'm planning to move. I want to get people to listen to the full podcast. So it'll be some trial and error, candidly, in the beginning to figure out if those audio releases are going to be successful. And then that's where I can do more and not impact my budget. But then I could advertise as well and complement the audio sessions with some additional advertising. On the production side and the video, if I were to bring that in-house, I do think it's possible. The what I've learned is it's the editing that takes the most time, the setup, and you don't have to have a lot of equipment, actually. I should maybe throw you a picture of what our production space looks like with our partner. It is very nimble, and that I think is intentional on their part. It doesn't need to be overdone, overproduced, and I think, in fact, our audiences aren't looking for that. They're looking for that level of comfort, that they feel safe and uh, not overdone, not overproduced, because then that doesn't feel real or genuine. And then if they don't feel that right away, then the message isn't going to resonate, right?
Yeah. You don't want it to feel like a corporate video, right? Where it's very slick and polished or like a commercial. You want it somewhere
Yeah.
between, like a little bit raw, a little bit unpolished, if you will, but therefore feeling more authentic.
Yes.
Um,
Yes.
like the first few that you showed in your presentation and the ones I've watched online, it's just on someone's living room, it looks like, right? Just a couple
Hmm.
chairs, a nice lighting, and that's it. It's not a lot of fancy stuff in there. It gets a little bit more advanced as you go along, but not by much. It's not like you're in a studio by the end of it. So
Yeah.
I think it's a great acknowledgement of you did enough for your audience and you didn't do more than that because it wasn't needed.
Hmm. Yep. Exactly.
So Brittany, I have to ask this. If there was someone out there listening or watching this that wants to do something edgy like you did, with a podcast or with a video series that isn't 100% focused on just the clinician, but that tells these patient stories and personal stories, what would you recommend to that person to try and get this off the ground?
I would say, first, find your advocate. You need a clinical
Mm.
tie somewhere, because they also have the connections with your operations teams to help you push it forward. That was, I think, a key piece of this for me when we first started. Having Dr. Richards right away being like, yep, I'm in. And she was going to be the one that, if we didn't have a list of people ready to go, clinicians that were ready to speak, she was going to do them all. So that buy-in is really important. But I think for me, I didn't have to document every step or piece of the plan. I have a very supportive boss, who gives me a lot of autonomy to try things. She hired me to do this job and she trusts me. So I think that is very important. But if you don't have that, I think you can find it in other leadership. Just try it. Don't be scared to try something or to push an idea forward that you think is going to work.
Love it. Love it. And what recommendation would you have in terms of which platform do you think you found has worked well for health systems?
I think the video piece for our health system, and I think any brand, is about making a visual connection to the people that they haven't seen yet, in clinic or in practice. So putting our people on camera was really important. But if you don't have that resource, I think you can start with sound. Just find the right voice and the right fit in how you talk about whatever it is that you're going to explore in this space. I think that's okay too. And that's why the secondary series with our audio pieces is going to be trial and error, but I think it's going to be successful.
Well, Brittany, you shared so much great information with us today. Where can people go to connect with you and to learn more about your organization?
Me personally, you can find me on LinkedIn, Brittney Strum. Happy to connect with anybody and share resources and information. And then for the podcast, Pelvis Party, they're on all platforms wherever you listen to your podcast. We're on YouTube. We're also on two social channels, Instagram and TikTok, at Pelvis
Awesome.
Party.
Perfect. I was just going to ask that. What's the handle? Awesome. Well, Brittany, thank you so much for your time. Thank you so much for sharing this information. It's been really great having you on the program.
Thank you, Colin. And I'm looking forward to seeing what you do next too. And I love watching all of your educational pieces. So doing really great work at Sway Health.
Oh, well, thank you for saying that.
You know, when I first saw Brittney's presentation at SHUSHMED, I was fascinated and I just had to learn more. I'm so happy she agreed to join us here at Sway Health. I loved how she chose to engage with a local influencer who not only had the audience that they were looking for, but also was passionate about the topic. And on top of that, their minimalist approach to launching the video and the podcast using the basement and living room of their collaborator is just so smart. It's very easy to get caught up in spending a lot on a studio and camera setups, but that can result in a lot of unnecessary spending. Better to start and figure out what you really need and go from there. And hey, if you made it this far in the video, we'd really appreciate it if you mash that like button, click subscribe, or write a nice comment below. Also, head over to Sway Health, that's Sway with 2 A's, .health, where you can find more great content like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.